Hi, Miss Roma. I wanted to do a quick sound check with you. If you could check in. Can you hear me? And I lost her. How about you, Dr. Greg? Can we do a quick sound check with you?
Yeah, I can hear you guys great.
Great. We can see you too. Thank you. Hi, Dr. Shamia. This is Charity. Wanted to check in on your sound check, please.
Can you hear me?
Yes, sir. And I can see you. Thank you.
Disappear till we start. Thank you.
Thanks. Hi, Dr. Hurt. Wanted to do a sound check with you real quick, please.
Hi there, how are you?
I'm good, thank you. We can hear you, thanks. How about you, Miss Roma?
Okay, can you hear me?
I can, that one's kind of faint. Can you say something else again?
How about now?
A little better. It's kind of low for us. I'll try to turn up our volume as well.
Okay, I'll be right back.
Okay, all right. Mr. Sanders, can we do a sound check with you?
Can you hear me?
I can, thank you. Ani, let's try you again.
How about now?
Much better. Great, thank you. Dr. Gotcher. Oh, he's stepped away. Dr. Souza.
Good afternoon.
Gotcha. Dr. Gotcher, can we do a sound check with you, sir?
Can you hear me okay?
Yes, sir.
Okay, that sounds good. I am assuming, and Mr. Sanders, you may want to be guiding us in this new situation we're in. Do I still work to sort of call the meeting to order and such, or since we are advisory, does Dr. Buchanan do that, or how do we start and proceed?
I had suggested to Dr. Buchanan that she convene it, for lack of a better person. The entity of which you were the chair no longer exists.
Okay.
So they can elect you again as chair if they'd like. That's probably needs to be the first order of business, is to elect a chair. But until they do, I think Dr. Buchanan is a reasonable person to call the meeting to order.
Okay, that sounds good. And then until we discuss that, I guess she would conduct the meeting then.
Yeah, I assume she'll convene, and hopefully
Okay,
you're all elected officer pretty soon.
works for me. Okay.
Good evening. So I believe, per Mr. Saunders, I will at least get this meeting started this evening. So first of all, we have a quorum. We need to, Anderson, if you'll conduct the roll call, please.
Thank you. Dr. Drake, Dr. Gotcher,
Here,
Dr. Hurt.
Here.
Oh, thank you. Mayor Jacobs, Dr. Shamia,
Here.
Dr. Souza. Here. Ms. Wagner.
Here.
Thank you. Dr. Buchanan.
Present.
Thank you. And Ms. Roma.
Here.
Okay.
So we have quorum, as defined by, 50, we have at least 50% of our membership here. And so I think we'll wait on board business until we finish the public forum, if that's agreeable to everyone. Well, we don't need to take up the public's time with our board business. So like by that, I mean deciding who might be the chair and those kind of things. So Anderson, we can go and get started with public forum if you're ready.
I am. This is Anderson Little with the Knox County Health Department. Up first, we have Richard Cunningham. Dr. Cunningham, please state your name and address for the record, and you will have 3 minutes.
Thank you. Richard Cunningham, 1836 Bombay Lane, Knoxville, Tennessee, 37932. Thank you for the opportunity to address you. The good news is now the Board of Health has gone from weekly to biweekly to monthly meetings, and the Health Department only updates benchmarks once a week and has stopped any COVID briefings. That sends a clear message that we are returning to normal. Yet Dr. Buchanan has chosen to double down on the most restrictions in the entire state of Tennessee, while the real data contradicts her. Let's do a comparison. Knox County is more restricted than any other county in the entire state. No surrounding counties have any restrictions or mask mandates, yet their viral curves look identical to Knox. Knox continues to restrict restaurants and bars to 50% capacity and curfew of 1 a.m. Again, the most restrictive in the entire state. Let's take Hamilton County, which includes Chattanooga, probably the most similar one to Knox. No restrictions. Their mask mandate sunsets next week for good. Nashville. Friday, Nashville goes to 225 people per floor of restaurants and bars with a 3 a.m. curfew after hitting a 30% vaccination benchmark, while Knox's benchmark is over 37%. How about Texas and Mississippi? They rescinded all restrictions and mask mandates over 6 weeks ago. How are those Neanderthals doing? Cases, hospitalizations, and deaths continue to plummet despite the expert warning of impending doom. Even New Hampshire has lifted their mask mandate. How about Florida? They've been unrestricted with no mask mandate since September. They repudiated Fauciism, they protected their seniors, and their approach has been proven correct again, defying the so-called experts. Once again, Florida defeats Tennessee. Who's doing the worst? The worst lockdown states include Michigan, California, New York, and New Jersey. What a surprise. What are we doing in Knox County? We're still punishing our hospitality industry, which has bent over backwards to safely serve their customers. We are still under a ridiculous mask mandate. We are masking kids, an absolute absurdity with zero data to support that. Hospitals are wide open. The benchmarks are green. Vaccinations are over 37%. Plus, we have natural immunity from people that recovered from COVID. Why are we the most restricted county in the state of Tennessee? It's simply nonsense. Lift all restrictions, rescind the mask mandate. You want to wear a mask? Go ahead. No one needs a mandate to wear a mask. Above all, stop the child abuse of masking kids. Thank you.
Up next, we have Wendy Harday. Please state your name and address for the record, and you will also have 3 minutes.
Okay. My name is Wendy Harley. I live at 37932 Knoxville, Tennessee. I come to you today with concerns about misinformation and censorship, specifically related to masks and prevention of spread of SARS-CoV-2. As a registered nurse myself, I bought into the lie from the beginning that masks help, and I had lots of fear and anxiety surrounding this treatable virus. Then I started my search to find the truth. The more I searched, the more evidence I found and the more peace I felt. Masks were only meant to prevent droplet transmission for close contact situations. It does not stop airborne spread because size matters. Viruses are 50 times smaller than bacteria and 1,000 times smaller than a hair. Wearing a mask to prevent catching SARS-CoV-2 or similarly sized influenza is like throwing sand at a chain link fence. It doesn't work. Exposure to one virus particle is theoretically enough to cause infection and subsequent disease. This is not an alarming thought. It simply means what it has always meant, that our immune systems protect us continually all our life. Also, the longer masks are worn, they carry a lot of bacteria and viruses. Most of us wear masks incorrectly, and we actually touch our masks substantially more, spreading bacteria and viruses to our face. The focus the government has had has been more dominant on proper and frequent hand washing, which goes, or it has been more on mask wearing than on proper frequent hand washing, which goes against all medical education. The tighter a mask fits, the more likely it is to reduce blood oxygen levels and to increase the amount of carbon dioxide instilled and being inhaled. This makes you breathe harder and faster. Dr. Fauci stated in January 2020, in all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of outbreaks. The driver of outbreaks is always someone with symptoms. It took one person who was thought to be without symptoms to spread it to 16 people to start lockdowns, quarantines, and mask mandates. With just a little more investigation, it was found that this person was actually under treatment for severe flu. In a comparison study between North Dakota, who mandated masks and had business restrictions and lockdowns, compared with South Dakota, who did not, South Dakota actually did better with less cases and spread of the virus. The New England Journal of Medicine stated, "It is also clear that masks serve symbolic roles. They may help increase health workers' perceived sense of safety, well-being, and trust in their hospitals. Although such reactions may not be strictly logical, we are all subject to fear and anxiety, especially during times of crisis. One might argue that fear and anxiety are better countered with data and education than with marginally beneficial masks. The fact is, after reviewing all of the studies worldwide, the CDC found, quote, no reduction in viral transmission with the use of face masks, unquote. Please withdraw the mask mandate in Knoxville. Thank you."
Up next, we have Kevin Hill. Please state your name and address for the record, and you will also have 3 minutes.
Kevin Hill, 509 Cambridge Street, 37920. Let us review the past 8 months. Starting in August of 2020, several of us, including ones on this call, doctors and nurse practitioners, questioned the accuracy of PCR tests. These concerns as uninformed. Fast forward to January 20th of 2021, and the World Health Organization admitted the rates were too high and were generating false positives. Did Knox County ever hear from Martha Buchanan or other members of the former Board of Health on that matter? No. Also, we have challenged the efficacy of masking the population for prevention of the spread of COVID-19. During this time, we have pointed out a very long body of peer-reviewed literature spanning decades of research and concludes face masks are not effective. Rather than review all of this, let me just quote from the most recent article from Stanford University, Face Masks in the COVID-19 Era, a Health Hypothesis. This article, published by a division of the NIH, concludes that the existing scientific evidences challenge the safety and efficacy of wearing face masks as preventative intervention for COVID-19. The data suggests that both medical and non-medical face masks are ineffective to block human-to-human transmission. I could read more, but I don't have time. The bottom line is that we are 8 months in, and Martha Buchanan recently stood before the Board of Education and declared that the question of face mask efficacy is a settled matter, while at the same board, members of that board had to inform of her own department's numbers. These are just some of the examples of why the former Board of Health was dissolved in lieu of the current advisory board. And as such, I'm here to ask you for advice tonight. We have already seen Director Buchanan's ignorance of the medical literature on masks. Now, as a community, we're watching Director Buchanan exercise ignorance of the authority that she holds. That would include, unfortunately, our mayor and law director as well. Lawyer Andy Fox has clearly delineated through documents provided to all of the above. The powers are limited to only closures, and that the face mask is limited to the mayors in counties such as we are now that don't have a Board of Health. So I'm asking you to end our medical incompetence in this county and make one piece of advice to end your tenure. Recommend that Martha Buchanan resign her position and the county dissolve your entity. Thank you.
Up next, we have Sherry Garrett. Please state your name and address for the record, and you will have 3 minutes.
My name is Sherry Garrett. I live in Knox County. We're 1 year into this pandemic and 9 months into this board's mandated masking as a way to mitigate the spread of COVID-19 virus. In spite of the fact that there are 40 years of scientific study that has proven that masking does not prevent the spread of any virus, including the 2015 study on cloth masks, which concluded that the results caution against masking due to moisture retention, reuse of cloth masks, and poor filtration, which may increase your risk of infection. Yet for some reason, the only way to prevent this virus is masking. Nothing is said about healthy living and prevention. Nothing is said about early treatment, which is effective. Why? Does it not fit the narrative? Or is it more of a financial incentive? One must realize that the sicker you keep a population, the more medical treatment is needed. Therefore, the more money is made by physicians, hospital corporations, and pharmaceutical companies. It has been proven that the widespread use of cloth masks increase the risk of respiratory infection, as shown by the 2015 study at the University of South Wales. I don't know what your incentive is to keep people masking. When are you going to admit you were wrong? Have you seen the research yourself? Or are you going to blindly continue to follow what someone else tells you without using your own critical thinking skills? Have you looked at other states and counties that do not mask? You will see the curve is the same. I have enough sense to check things out for myself before believing it. Do you? Thank you.
This is Anderson Little with the Knox County Health Department. Our final member of the public forum this evening is Debbie Stafford. Please state your name and address for the record, and you will also have 3 minutes.
Hi, my name is Debbie Stafford, and I live in Powell, Tennessee. I come to you today mostly as a nurse practitioner, and I'm sharing my screen. Let me just go ahead and unshare that real quick if I can. So as a nurse practitioner, I've treated COVID. I've treated probably 100 cases of COVID. A couple weeks ago, I had a child come in we thought might have COVID, teenager. And I said, go to the health department, get a test. You'll have to look on the website to see where they're offering it. And she said, well, they're only doing it 1 day a week. And I said, no, our health department can't do that. We're still under a pandemic. They're testing it. You know, maybe you're mistaken. No, only 1 day a week. So I got on the Knox County Health Department website and looked. And I was shocked to see that the Knox County Health Department, who has done a pretty good job all along, actually an excellent job on testing. I mean, we did have that huge delay when we were at the peak of our pandemic, but you all have done a pretty good job of getting the testing out there. And I was shocked to see that you're only offering testing 1 day a week. And your website says, well, you can go to all these other places. But what you all need to understand is that a lot of people can't afford the $100 to $300 to go all the other places to get tested. In my clinic, if they have insurance, sure, I can swab them and send it to Quest. But if they don't have insurance, then I have to charge them a cash price. because I don't take insurance. It's extremely expensive for these families. And if you have a high deductible insurance, I don't know if COVID pandemic stuff automatically covers it, but for my many non-insured patients, they have nowhere to go. So I don't understand why you all are calling this a pandemic on the one hand, but then on the other hand, only permitting testing 1 day a week. Is it a pandemic? Is it not? If it's not, then our health department needs to be offering 4 to 5 day a week testing. It looks like you're still offering 4 day a week testing for STDs. So I really don't understand why we're in this quote pandemic that's shutting down society, that's causing all this division with the masking, but yet you're only offering free testing 1 day a week for our community. And I'm going to try and share this with you. I am technologically challenged, but I ran through this earlier with someone. I've been doing some independent research and it's not going to let me do it. Excuse me. Maybe it is. Can you all see this? I'm going to assume yes, since no one's answering me, but Knox County COVID cases, there's the graph.
Sorry,
We cannot see.
we can't see whatever.
Can't see it. Okay, well then I'll get out of it. There's no need to waste your time. But I went through and compared different counties around us that don't mask with Knox County that does, and there's no difference. And so I just implore you all, one healthcare professional to another, if it's not truly a pandemic, please let's end all this. When we continue this arguing, this division, this saying it's a pandemic on the one hand, then on the other hand, not treating it as such, all we're doing is making our public, our patients who need us, have a worse and worse outlook on healthcare. I respect you all. I think you've all tried to do the right thing. I've disagreed with a lot of what you've done, but I've not been in your shoes.
Thank you, Ms. Stafford. Your time is up.
Okay, thank you.
Dr. Buchanan, that concludes the public forum for this evening.
Thank you, Anderson. Does anybody have a response to what we heard from public forum?
Dr. Buchanan, do you have any comments about the availability of testing that Ms. Stafford referred to?
Sure. We made a decision to reduce testing based on the fact that the number of people we were testing on a regular basis had gone down, and we needed to refocus on vaccinating. There are places where people can get tested, and we stepped into the gap when no testing was available and provided testing during that time frame. As testing became more widespread and we were testing fewer people and needed to focus our resources on vaccinating, that's what we did. So that's what we've done. I don't know who else. I don't know if the hospitals are still testing, but there are other places where people can get tested. The regional health offices are also testing. So the testing is available in our community. The need for testing has greatly decreased, and that's the need to vaccinate went up, and the availability of vaccine went up, and the demand for testing went down. So we were able to shift our resources, and thankfully, over 30% of our population has had at least one dose of COVID vaccine. And just a couple other things, looking at data. When we look at data from the public health perspective, we really have to look at the consensus of data, not a single study, not a single opinion. And we look at the data on masks and the data on some of the things that we've done. It's a long list of very highly respected educational and public health institutions that support the recommendations that this board has made. And all of you know that, being health professionals, know that we've looked at data and used data to make our decisions. But the list outside the Tennessee Department of Health and the CDC that recommend masking, the Academy of Pediatrics, the Academy of Family Practice, NIH, World Health Organization, Johns Hopkins, Vanderbilt, the American Medical Association, the American Hospital Association, the American Nurses Association. So it's a long list who recommend that. And we really go with that consensus, and we're making recommendations for the general public. Regarding restrictions, I actually have a table that summarizes the restrictions across our state. And I'll just be honest, Knox County is not the most restrictive county in the state. We might be the most restrictive county in the East region because we have a mask mandate and one other regulation. So we have two regulations in place. When we look at Nashville, they have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 different restrictions. Everything from limiting the number of people in a bar to limiting how many spectators can go to sporting events, to limiting closing steam rooms and saunas and some other things. Shelby County has 1, 2, 3, 9 things in place. They both have mask mandates and they both have some limitations on bars and restaurants. But then they go on to limit other things such as live music. In Shelby County, the performers have to be at least 18 feet from the audience. Curbside service must end at 1 a.m. in Shelby County. So, and the list goes on of other small things that are different than what we have. And we look at numbers in our metropolitan areas, and we really can't compare them to the numbers in our more rural counties. We are different than a rural county, just like Nashville is different than we are, and Shelby County is different than we are. They're more densely populated, and honestly, we've had some really very specific regulations in place. They've let some of those go, but they certainly haven't let all of them go, and all the restaurants still have to limit seating so that 6 feet of distancing can be allowed between groups, and they can't seat more than 8 people at a time. And so that really does limit those restrictions continue to be in place there. So I just wanted to kind of bring that up. It's been mentioned several times that we're most restrictive, and it's just not true. That's all I have. Does anybody have anything else? Okay. Hearing none, we will move on. I would like to go ahead and I do believe we need to have someone chair this body. And I would like to go ahead and move forward with taking nominations from the floor. Mr. Saunders, you unmuted yourself. Do you have something to say?
No, I don't. I was just doing so anticipatorily.
Okay.
If I
Thank
had
you.
any questions.
Thank you. Do I hear any nominations to chair this body? Or any volunteers?
I'll nominate Dr. Gotcher.
Second.
Dr. Gotcher, do you accept?
I'm okay with that.
Okay. Thank you. I make a motion that nominations cease.
Second.
All in favor? I think we'll have to take a roll call, though. We'll have to take a roll call on ceasing nominations, and then we'll have to take a roll call on Dr. Gotcher. Anderson,
Okay.
First ceasing nominations.
Okay. Let's go ahead with Dr. Gotcher,
Yes.
Dr. Hurt,
Yes.
Dr. Shamia,
Yes.
Dr. Souza,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan,
Yes.
Ms. Roma.
Yes.
All right. Unanimous with everyone in attendance. Do I just move on to the nomination of Dr. Gotcher at this point?
Yes.
I mean, Dr. Gotcher. Okay. So Dr. Gotcher?
So I'll abstain.
Okay. Dr. Hurt,
Yes.
Dr. Shamia,
Yes.
thank you. Dr. Souza,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan,
Yes.
Ms. Roma.
Yes.
So that's 6 yeses and 1 abstaining.
So that motion still passes.
Passes. Okay. Thank you.
And before I turn the meeting over to Dr. Gotcher, if you don't mind, I'd take a little privilege here. And I just want to say thank you to all of you who have agreed to continue to serve on this board in this advisory capacity. I've appreciated your advice and your counsel throughout the pandemic, and I'm grateful to continue to have it. And so again, just thank you for that. And thank you for staying the course and providing wise counsel. And I trust that you will continue to do that. And I greatly appreciate it. So thank you.
Thank you, Dr. Buchanan.
Sure. So I think we've got a lot of business to take care of, Dr. Gotcher, and I'm wondering if we want to move educational institutions up. We haven't set the agenda yet, so we'll have to do that, but I'm asking if we can move those ahead of all the other business so that Dr. Greg, who's on, can sign off if he needs to, if that's agreeable. So that would be an amendment to the agenda, just to move that up in the agenda.
So thank you, Dr. Buchanan. With that, if we look at our agenda, the next item is to set the agenda, and Dr. Buchanan has suggested to help Dr. Gregg out that we remove the educational presentation and question session from 9 up to 7 on our agenda. And I guess we need a voice vote on that, or a motion in a second, and then a voice vote on that.
I'll second Dr. Buchanan's motion.
Okay, so we have a motion and a second. Any discussion? Hearing none, since we're ready to vote. So Ms. Little, if you will conduct a roll call vote for that, please.
Absolutely. On the agenda, Dr. Gotcher,
Yes.
Dr. Hurt,
Yes.
Dr. Shamia,
Yes.
Dr. Sousa,
Yes.
Ms. Wagner,
Yes.
Dr. Buchanan,
Yes.
Ms. Roma.
Yes.
All right.
Okay, thank you.
Thank you very much.
You have approved the amended agenda for this evening. And so the next thing on the agenda is the questions for educational institutions. And we'll start with the University of Tennessee. So Dr. Gregg, I see that you're present. If you would like to guide us through your information, please. Thanks.
So thank you. It's a pleasure to be with you again this evening. We are beginning to wind things down over on campus. Our pooled saliva testing will be finishing up here on Friday. This coming Friday will be our last pooled saliva event. And then classes end the following Friday, and a week of finals, and then we're done for the spring semester. We are continuing our current restrictions that we have in place currently. We have seen good results with the things that the mitigation strategies that we've used on campus throughout this semester. Fortunately, didn't see a spike in our numbers like we did in the fall. And we continue to have a decrease in the number of new cases, active cases, and those in self-isolation, both in isolation and quarantine. So we are pleased with how things have ended up for us here in the spring semester, and are hopeful for a great summer as well.
Thank you, Dr. Gregg. Any questions for Dr. Gregg regarding the University of Tennessee's report?
Yeah, the only question I have, Dr. Gregg, is do you have any idea what your vaccination rate is for students and faculty on campus? I know that's hard to assess.
It is difficult for us to assess, although we have gotten in touch with the Tennessee Department of Health, and we're trying to ascertain how we might best come up with that number. Have been talking with general counsel and getting them involved in the discussions as well. We just want to make sure that we have a good feel for the percentage of those who are vaccinated on campus, especially as we begin to move to the fall semester.
Thank you.
Any other?
Dr. Gregg, I just had a quick question. Dr. Gregg, are you planning on continuing doing any vaccine clinics over the summer on campus?
Yes, we had a meeting earlier today. To this point, we've given just a little over 12,000 vaccinations on campus. And we will continue to use the Student Health Center as a vaccine clinic, and we'll open that to the public as well, so that folks can schedule with us to get their vaccines. We're hopeful that Friday, the FDA and the CDC will permit the Johnson & Johnson vaccine to once again come off its paws and be utilized. We had a lot of folks that were really waiting for that particular vaccine, and we still feel like we have a fair number that would prefer to get that vaccine. So, but yes, we will continue that through the summer.
Any other questions for Dr. Gregg? If not, thank you very much for your report and your continued efforts. I think University of Tennessee is doing a great job. Next on educational institutions, we have the report from Knox County Schools. And Ms. Wagner, we have that report. Is there anything you'd like to add or kind of go over with us on that?
No, it's just that our cases continue to decline, and our quarantines continue to decline. And that's about it.
Okay.
Yeah.
Any questions for Ms. Wagner on the Knox County School report? If not, thanks for that report. Next item on the agenda will be the Knox County Health Department benchmark presentation from Dr. Buchanan. So Dr. Buchanan, if you have your report ready, we'd love to hear it.
So we're gonna start with a vaccine update.
Okay.
Real quickly before we move on to the numbers. So as you can see, vaccination continues to increase here in Knox County, or the number of people vaccinated continues to increase, with over almost 40% of our population having received at least one dose of a vaccine, which I'm really, really pleased with that, and very grateful to our partners such as the University of Tennessee, and all of our hospital partners and our private providers and pharmacies who are vaccinating. Very, very happy about that. So I think we're in a good place. Our biggest concern now is decreased demand for vaccine. We're seeing that at our clinics. Our private providers are seeing that as well, and our hospital partners are seeing that as well. It's harder and harder to fill a vaccine clinic. So I would ask this board to be our ambassadors for vaccine in the community, and encourage folks, if they have questions, to talk to their doctors or talk to you. The vaccines are very safe. The vaccines are very effective. We're hopeful that Johnson & Johnson will be released to be used, probably potentially with some guidelines. We'll see what they come up with. But between vaccination and some people having some immunity from having natural disease, I think that's what's contributing to our decreased numbers. But we're going to need to continue the vaccination. We're hopeful that they'll open it up to 12-year-olds, and are talking with different partners on how we can get children vaccinated. One of our big focuses will be back to school vaccine, though, because we've got a lot of kids who are behind, and we need to catch some of those kids up on routine vaccinations. But any questions about the vaccinations or the process here in Knox County? Okay. Then we'll move to the benchmark presentation, which looks different. Really decided to start showing you trends rather than just the benchmark data that's on the website. So this is our benchmark number 1, sustained reduction or stability in new cases for 14 days. And as you can see, over the last month, we have had a very slow decline. So we kind of plateaued, and then it looks like maybe we've plateaued again. We're just going to step down periodically, which is the right direction. We'd like to see more downward trend. We're averaging about 20 to 30 cases a day right now in the most recent past, or is it more like 40?
Closer to 30 to 40.
Okay. 30 to 40 new cases a day. There was a blip at the beginning of this week. There were several cases that were not reported by a particular provider. And those tests were obtained back in December of 2020.
January and February.
I'm sorry, January, February. and were just dumped into the state system last week. So we saw that blip happen, but those were cases that just had gone unreported by the provider. So this benchmark continues to, or is green at this time. So we're happy about that. Second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. If I'd known how many times I was going to have to say this, I probably would have named, we would have named this something easier to say when we were doing all this. Right now, our turnaround time continues to be pretty good, except we had some flags. This is turnaround time. So at this time, we'll be representing this as yellow. And partly a lot to do with testing volume. If you go to the next one, the testing volume has gone up, but it was on a steady decline over the past few weeks, and we have concerns over that. We just want to make sure that we really know what the burden of disease is. So we had some flags on testing volume. So again, we're representing this benchmark as yellow. So this third benchmark, sustained or increased public health capability. So we did change this to represent more where we are in the pandemic. So right now, our focus is really on vaccine. And just like testing and diagnosing COVID, we're not the only ones doing it. Lots of other folks are vaccinating. But we're representing this benchmark as green because we still see increasing numbers of people being vaccinated, or at least initiating the series, and then eventually completing the series. We are also looking to represent this slightly different?
This is Charity Menifee from the health department. This is the slightly different. We were doing week to week vaccine totals, but recognizing that that's going to plateau and even decline as the portion of people getting vaccinated go up. And so we really felt that this was about showing the increase in vaccinations across the community overall is where we are. So we have seen a little bit of a decline in the week to week for this week, but we've also noticed that there's getting to be, I think as more providers are coming on board and with what their internal resources are, we're seeing some delays in inputting their vaccines into the system. So sometimes we're about a week behind. So that yellow week that we had, it actually ended up going up the next week when data caught up to it. So we're looking at this very closely, but the overall trend is still an increase in vaccinations. So that's good.
Right. And we believe representing the percent of population vaccinated gives us a better idea of our coverage for the community. So I think it's a better representation of what we want to see. Next is our fourth benchmark. Healthcare system capabilities remain within current and forecasted surge capacity. And as usual, Dr. Shamia will share more about this in his presentation. But this benchmark continues to be represented as green. COVID patients, again, kind of look similar to what the cases look like. Kind of plateaued, maybe dropped a little bit. Hospitals are busy with other things, but COVID cases continue to kind of hang steady. We'd like to see them going down a little bit more. So again, Dr. Shamia will talk about that a little bit more with his presentation. And then if we look at our fifth benchmark, sustained or decreased COVID-related death rate or identified positive or probable cases. So, unfortunately, we continue to see people die from COVID. And we had that 1 week where we're able to represent the data as green because we'd seen a decrease. But in recent weeks, we've seen a slight increase, and I don't know if the hospital data will help us understand that better. And we're also we're making a change based on the White House Task Force report and how we determine green versus yellow using data that looks or reflects what the White House report has in it. So we thought that was a better way to look at it. I'm sorry.
This is Charity with Knox County Health Department. The only change that we went with the White House Task Force is they do have 0 as their threshold for green. And given the nature of this disease and looking at our data, we felt like that we should have a little bit more feasible number for that. And so that's where we've made that slight adjustment there to 0.5 new deaths in the last 7 days.
Any questions?
If not, thank you, Dr. Buchanan, for your report. Any other questions from the board on that report? Not, again, thank you for a very complete report. Next on the agenda is the University of Tennessee Medical Center Knoxville's data update from Dr. Shamia. And Dr. Shamia, if you're ready.
Yeah, thank you. So there we go. So we'll quickly go through the things that are really portraying some of what Dr. Buchanan portrayed just slightly differently, and then get to the hospital situation. Next slide, please. So this shows the, Dr. Buchanan mentioned this, there was this release of several positive results that go all the way back to January. And so when you see that most recent week, both in the county and the district of cases, that is not representative of this week. That's all of those cases together. So if you took those cases out, it probably does not reflect an increase. And even with that, it's looking that April will be an overall good month compared to the last several months in terms of new cases. Next slide, please. That same data release affected all the counties. So they're all up this most recent week for the same issue. And so again, hard to say definitively, at least from what is available to me, but it would seem unlikely that represents a true spike in cases. Next slide, please. So, and yet again, it affected all the age demographics. But I think what you can say here is that there's nothing dramatically different related to new cases. They've all essentially plateaued in a similar manner. That contrasts just a bit what I'll say about hospitalizations here in a minute. Next slide, please. So again, this is calculated slightly differently, but it would seem just based on the volume of testing, and we've mentioned this before, that you have to test a certain amount to drive this number down, that's just about where it's going to hover. And that I think the utility of looking at positivity rate at this point has decreased. Next slide, please. So in terms of new hospitalizations in the last few weeks, I should remember that we haven't met in a while, although this has been released. You see generally a level of stability in new hospitalizations. The district 4 weeks ago had what was a real and legitimate increase, but then it plateaued, and the county didn't see quite that much. So pretty steady. Next slide, please. So as far as the census, this across the district, across all those counties, has really plateaued. You see how flat that is, right in the 90 to 100 range. I can say that we still have our capacity call in the community where we compare COVID cases, and at our hospital, just in the last week, we've seen a flip where, and we haven't seen this in a while, where we actually, I think we have 21 patients with COVID-19, but 13 of those are in the ICU. But that has not been, meaning more in the ICU than in acute care. That is not a trend that currently has been seen at the other hospitals. The other thing I can say about hospitalizations is that, and this is again only for us because I don't have this data for the others, but our median age has dropped. And so if you compare to say in January, where we had a median age of around December, January was about 68 years old. That's dropped to here most recently 59 years old. Now, granted, the total number of hospitalizations is less, significantly less, but of those who are hospitalized, our data would indicate that it's a younger group than it was when we had a lot more hospitalizations. Next slide, please. And then this simply just shows the trend lines, which we always show you, but it does really, you see that the trend line for this week is essentially flat. So there's not been any indication for us to think that that's going to go up but there's also not been any indication to see that there's a reason why it's going to continue to drop, at least in the near future. I believe that is the end of the presentation. So Dr. Gotcher would be happy to answer any questions.
Great, thank you, Dr. Shamia. Board members, any questions to Dr. Shamia on the report from UT Medical Center?
Dr. Gotcher, if I could take this opportunity, I probably should have done it during Dr. Buchanan's remarks, but just to echo something she said, there's no question that the hospital systems have seen a decrease in vaccine demand, and it's quite significant. And so whereas we were filling appointments, we could fill between 1,800 and 2,000 appointments in 45 minutes. We are not filling, we're actually not even that close to filling appointments. And so anything that we can do, or maybe a conversation that we can have later in the meeting, just about how to increase that. But that's also part of, we've been very involved in the vaccination campaign. And so part of our hospital report is our vaccination report. And it was really steady there for a period of time. And the decline actually has been semi-abrupt, I would say. It was from very, very high demand, and now we've got supply and we can't fill appointments.
You know, one thing that the University of Tennessee Medical Center has done recently, which drives at least some of my patients to be vaccinated, is that for elective procedures, that if you are 14 days post-vaccination, that you would not require a 2-day pre-op COVID test. And so I've had, at least in talking to patients that are facing elective surgery within the next month or two, to go ahead and get their vaccination done so they won't have to, some of my outer town patients making a 100-mile or 120-mile drive to get COVID tested. So I also encourage every patient, I ask every patient that I see whether they have been vaccinated, and if not, that we have the capability here at UT, and it's seamless and it's very well done. And I would advise us to, talk to neighbors and friends. It's one person at a time. Sometimes it makes a difference.
Thank you, Dr. Gotcher. And just to make a follow-up comment on that is that, I mean, that decision wasn't made as a way to try to motivate people very, specifically. The intent was not to try to get people motivated to be vaccinated. It just made clinical sense. And we're not the only one that's made that decision, that if you've been definitively vaccinated, you should not need a pre-procedural COVID test. And so that was the basis of that decision.
Any other questions for Dr. Shamia from board members? If not, again, thank you so much for all your efforts. A good report. Next on the agenda is going to be discussion of organization of the new advisory board. And we have at least appointed one officer. I don't know what the entire slate of officers should or is supposed to look like. And then we need to have adoption of rules as a first order of business. So perhaps at this point, Mr. Sanders, I could have you maybe lead a discussion, a general discussion for us on what rules may be useful to adopt, or what direction that we should take as an advisory board at this time.
Sure. Let me just answer one question for you at the beginning. You need a secretary, and I think Dr. Buchanan's already sort of unofficially filling that role, but I suppose you could nominate her and vote on it, or nominate somebody else and vote on it. But and the committee needs a secretary as well as a chair. Beyond that, I think the message is that although we're all very familiar with each other here, and you all have been working together for a long time, this is a separate entity from the Knox County Board of Health, of which you were members up until recently. This is a brand new entity, and as such, you're sort of starting over from scratch. For instance, there were no minutes to approve today because this body cannot approve the minutes of a committee gone by. Dr. Buchanan and I have actually already been in contact regarding some proposed rules, taking the rules that the old Board of Health operated under and modifying them slightly. And I suspect she can show those to you all, and she can move them for you all to vote on them if that's her choice. I can't do either. So that she might be perhaps the one to take the lead on that.
Sure. On the matter of secretary, the county ordinance, paragraph 9 states that the county health director will serve as secretary to the board. So,
oh, perfect. Okay, so it's not an issue we need to deal with.
okay, so I think before we get to adopting rules, I guess two things. One, Dr. Drake has joined us. Welcome, Dr. Drake. Two, we talked once about having a vice chair so that in the event Dr. Gotcher is unavailable to chair, the vice chair could then chair the meeting. If the board would entertain that, I would like to open the floor for nominations for a vice chair who would chair instead of the board if we have a meeting that the board, chair instead of the chair if we have a meeting that the chair can't attend. So make a motion to nominate someone for vice chair.
I nominate Dr. Souza.
Second.
I think we would have to decide we want to have a vice chair first.
Oh, sorry.
So I make a motion that we have a vice chair.
Yeah, I'll second that motion.
Any discussion? Anderson, if you will.
Absolutely. Okay, to add a position of vice chair, Dr. Drake.
Yes.
Thank you. Dr. Gotcher.
Yes.
Okay. Dr. Hurt. Dr. Shamia.
Yes.
Dr. Souza.
Yes.
Ms. Wagner.
Yes.
Dr. Buchanan.
Yes.
Ms. Roma.
Yes.
And Dr. Hurt.
Yes.
Oh, thank you. Perfect. All right. Passes unanimously with all in attendance.
Now, Dr. Gotcher, I will give the meeting back to you, sir.
Okay, thank you. So we have established a position of vice chair. So we can now open the floor for nominations and seconds for vice chair of the advisory board.
I nominate Dr. Souza.
Second.
So we have a nomination and a second. Are there other nominations? Hearing none, we will hold those nominations closed. So let's go ahead and have a roll call vote on the
We
vice.
probably should make sure Dr. Souza is willing to serve before we vote. Dr.
I would be honored to serve in this position.
Thank you.
You've just done a great job when I punked out and couldn't do it. So thank you very much for your past efforts as well, Marcy. I remember one time I was in the dang operating room and was running out from one room to the other, and I was trying to chair it. It didn't work very well. Thank you for helping.
All right. Let's go ahead and take a vote for Dr. Souza as vice chair. Dr. Drake.
Yes.
Dr. Gotcher.
Yes.
Dr. Hurt.
Yes.
Dr. Shamia.
Yes.
Dr. Souza.
I'll abstain.
Okay. Ms. Wagner.
Yes.
Dr. Buchanan.
Yes.
Ms. Roma?
Yes.
Okay. That's 7 yeses and 1 abstaining.
Thank you. You have elected Dr. Sousa as the vice chair of our advisory board. And any other officers that are necessary that come to mind either from the board or Mr. Sanders? I can't think of any. Maybe we should keep things lean in terms of that. Mr. Sanders, anybody else we need to consider or any other position we need to consider?
Sorry, I was muted. Not that I'm aware of.
Okay. So next up on the agenda, this is kind of a flip after appointment of officers, is adoption of rules. And Mr. Sanders, could you maybe lead that discussion for us?
Well, I'm not sure I'm the appropriate one to lead it. I can tell you that I discussed some proposed rules with Dr. Buchanan, who I assume has them back at this point. And since she's the one who made the first chop on them, and she's the one who has the authority to be able to move them for the committee's consideration, I think she's probably the one to lead the discussion. I'm not a member of the committee.
Okay, Dr. Buchanan, if you have some information for us on those rules, please.
I do. So I'm going to have Catherine pull up our old rules, not existing rules, excuse me, our old rules, which were based on the commission rules. And I'm going to run through some suggested edits for that. And Anderson, before you go too crazy, I have this written down. So I'll share it with you when we get done. So first and foremost, obviously, we have to change the title since our title is different. And so on the front page, and what I do with that page, I had it just a second ago. Here it is. And so we need to change it to the Knox County Advisory Board of Health and change and obviously update when it was revised. So those are pretty easy things to do. Most of these are pretty easy changes. And then when we look at the first or the second page that really has some information on it, they can't see my arrow. Catherine, if you can, yeah, up there, the board meeting shall begin at 5. We talked about that if with virtual meetings, 5 o'clock works for everybody, but if we go back to in-person meetings, we might need to move them to 5:30. So my suggestion is that we leave that option in there and we just change the verbiage to reflect that if it's virtual, it's 5 o'clock, if it's in person, it's at 5:30. And the notices will have to reflect that as well. And then we would just make those changes throughout the document to reflect that. And then further down, still in the same first paragraph, where it says the chair shall convene. Since this board is to advise the health department, my recommendation would be that it would be the health department or health director or health officer who would convene the board, if that's okay with this body. Because it would be when we needed, meet quarterly, or if we needed to have an extra meeting, it would be up to the health director to call that meeting. So, and then, hold on one second. So then down in the order of business, proposed board actions or recommendations, we won't be making regulations anymore. So it'd be recommendations, actions, recommendations. I'll just change that verbiage there. And then we move on to page 4. And under section 1, oops, sorry, are we on page 4? Section, 4, sorry. Yeah. Everything on page 3 was left as is. So when we look at page 4, section M, ordinances, emergency ordinances, and resolutions. So my question was, do we still need this section? And so I'm sorry, I'm reading Mr. Saunders' reply to me because I can't remember what he said. Okay, so he's recommending that we change the language to not have ordinances and emergency ordinances in there, but this talks about how we would vote. So, and again, I'll bring this back before this board for final approval, I think, once we get the edits made. We would need to, and I didn't do this, so I haven't done all the work to take out ordinance and emergency ordinance from the language in this section. But this does tell us how we're going to vote. And so I do think we still need this on just kind of the process of voting. So if everybody's okay with me removing regulation and ordinance from this section and really just talking about resolutions and recommendations instead. This again just tells us how to vote. So
Martha, just a quick question. If we are not actually making regulations and ordinances, do we need to do a roll call vote all the time? I don't know if that's a question for Mr. Sanders.
As far as I know, as long as you're virtual, you have to do a roll call vote regardless of what you're voting on. I know it's cumbersome, but I'd appreciate you going ahead and doing it.
Okay, thanks.
Could I ask a follow-up question? And just in that, in most circumstances where people are providing counsel to other people, they're not voting on everything. They're just discussing things, airing out opinions. And so I understand that if there's a vote, it's more official, but I guess I'm not sure I fundamentally understand the role of a vote at all in an advisory group.
So Dr. Shemaya, you're right there. When I replied to Dr. Buchanan, I'd actually noted that there are sort of two directions this body could go, and it's either way is appropriate. It's simply up to you as to what you want to do. That is, it is a little cleaner for you to vote on something, and that way there's a record of what the board voted to advise. But it's true that Dr. Buchanan is not obligated to take the board's advice. And if she's more comfortable, this board's more comfortable, simply making this more of a roundtable type group where you offer opinions and let that be it, that's fine. As far as minutes go, you need to record what was voted on. There's no obligation to record the specific substance of a recommendation, but for posterity's sake, it's cleaner if there's actually a recommendation and a vote, which is recorded in the minutes. That way someone can go back a month later, a year later, and see what the board recommended at that time, rather than having to view videos to find out. But it's not a requirement. You can do either.
And I'm comfortable either way. And I didn't finish reading Mr. Sanders' response to my question. I'm comfortable with this simply being a discussion and recommendations, and then how I would see that working is at the end, we would just summarize the recommendations that were made from the board, and that would be recorded in the record.
This is Maria Hurt. I guess what I envisioned in the shift of our responsibility was more of a round table. I don't know what my fellow board members were thinking, but I appreciate Mr. Sanders, you saying, either way is acceptable and we can decide. But myself, I envisioned a round table and something a little less formal. We don't have power, not that we ever asked for it, but if we're here to advise, I guess it makes sense to me that we're here to discuss, but I'm not sure I really understand the value of voting on our discussions that support ultimately Dr. Buchanan's decision. Food for thought.
And Dr. Buchanan, I'm not fundamentally opposed to voting at all. And so it's really about what's going to help you. What is the format that helps you take that information and let it be a piece of what you're considering as you're making decisions. And you already mentioned that you could go either way on that, but just because I raised the question doesn't mean that I'm fundamentally opposed to voting. If that's what helps you the most to know kind of where we all stand on something, that's fine. But I think I was envisioning more of a roundtable as well.
And I, again, this is kind of new for all of us. And I'm fine with roundtable. I'm fine with striking this. It honestly might shorten our meetings to not have to go through and vote on everything and follow all of that process, which as an advisory body would not be a bad thing, or for even anybody, it's not bad to have a shorter meeting. So I think what would work for me is, and because what I really need to know is, the summary of what the recommendations are. And so if we can keep track of those, and then at the end of the meeting and kind of just run through those here, as I understand, blah, 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 blah. And then, we go from there. I'm totally fine with that. If everybody else is okay with that.
Dr. Buchanan or Mr. Sanders, is there any legal reason that a vote would be favorable or unfavorable in your decision-making process?
So the only issue I could think of is, I can foresee a situation in which the actions of the health department are challenged on some grounds, and and some element of the evidence regarding that challenge is going to be that the health director acted in accordance with or against the wishes of the advisory board of health. It's just one piece of evidence. It's not dispositive, but it's a piece. And so that's a double-edged sword, right? It's sometimes helpful, sometimes hurtful. I can't tell you all how to act. I'm just making you aware that if you establish a formal record of something, then the health director is going to be held more accountable to acting in accordance with that formal recommendation, for good or for ill.
This is Maria Hurt again. I'm a little confused. I mean, legally, if we're advisory, certainly she can or cannot take our advice. What I understand you're saying is at some point, theoretically, there might be a challenge that says, hey, she didn't take our advice, but that puts us back exactly where I think we were last month and the past year, which is that we have that much power or sway. And I mean, why should she be held to our advice? I guess in tangent to that is that how other advisory bodies work, that the person taking advice could be ultimately beholden to their advice or get into some kind of hot water for not taking their advice. I mean, surely our mayors and other public figures have advisory boards, and that's just what it is. It's not that it doesn't put them in peril at some point for not being accountable to an advisory board. It seems to switch ultimately where the buck stops.
I think it's somewhat loose, Dr. Hurt. It's not a hard and fast standard. I'm just saying, as I said, it's just an element. It's one little piece of an overall picture, which is purely speculative at this point. It may never happen, and I can't envision exactly how it might happen. But I'm just making you aware that if it suits someone's purpose to be able to say that the health director acted in accordance with or against the advisory board's advice, they're going to do that. That's just the way people work. So if you establish a formal record, that's part of it. But that's also, it's good for the health director too, if she's acting in accordance with the advice. It's not, there's no perfect answer here. You're not going to get one. It's just a piece of the thinking.
Yeah, thank you. I'm not looking for a perfect answer. I'm just looking for clarity. And on that note, I'd like to know, in terms of advisory boards in general, I am not in the know about how many advisory boards there are around town that support our public authorities, like both of our mayors. But by nature, being an advisory board, what's the connection between that and sunshine laws? Do all other people who advise other public figures in our community, are they always sunshined as?
It depends on how you're looking at it. I think a formal board that is organized to advise should be sunshined. That is, you are debating public policy, you are advising a public figure, and our department's advice has always been sunshine those meetings. Of course, every public leader has conversations informally with other people. And those meetings are not sunshine. They have, I'm sure various public officials have, a dozen conversations a day. But when you have a formal board together like this, I think it is typically sunshine, or should be, because you're conducting the public business here. And Dr. Hurd, I don't know if you're still with us. You're frozen on my screen.
I'm sure she'll come back to us eventually.
Yeah, Dr. Buchanan, as long as we have a slight lull here, one thing I would suggest is going back to that section about who calls the meetings, whether it's the chair or the health director. You may not have seen my comment, but I think you're setting up a potential adversarial situation. We're talking about Section 1, Roman numeral 1, Rule Roman numeral 1, Section A, convening the board. That would be on page 2, I suppose. I think having you have a chair, you've just elected a chair. I think having somehow the health department, health director taking over the role of the chair and calling the meetings, not calling the meetings, is a little problematic. You now have a chair, and I think the chair ought to run the meetings. This board is not subservient to the health department. It just simply advises the health department. So that would be my advice, is to allow the chair to continue to have that authority, rather than take it on to put it on another entity, whether it's yourself or another entity somewhere.
I'm fine with that, and you're right. I did not. The way this printed out for me to look at is confusing, so I apologize for that. And Dr. Gotcher, as long as you're okay with that, I'm fine with you calling the meetings. I guess where I was coming from was, deciding when to call a meeting, other than regularly scheduled meetings. The board may not be aware of some issue that we would want to convene them for. So I can obviously communicate that to Dr. Gotcher and ask him to call a meeting regarding XYZ, and I'm fine.
Dr. Buchanan, I would be receptive to that. I think that our task is to advise you, and anything we can do to facilitate that, we should do. So if you felt that was necessary or useful, then we would do that. And Dr. Buchanan, I have another question for you. We've discussed formal votes, roundtable discussions with consensus maybe. What works best for you if we are advising you? What would tend to work best for you?
I really honestly think to have the roundtable discussion, and then as we conclude discussion, summarizing what the recommendations are, and making sure we're clear on what those are and documenting those. I think that works just fine.
Okay.
I think we can facilitate discussion that way, and obviously if we summarize something and somebody is like, no, that's not what I meant, we can change that. But I'm fine with keeping track. We would still be documenting the recommendations of the board, just not with voting.
And I would love to hear from board members about their thoughts on this as well. Dr. Buchanan, I tend to agree with you, and Dr. Hurt, I tend to agree with you that not quite as formal discussion format may allow us to discuss things in greater detail, or to bring topics in that might be off topic in a formal resolution.
Yeah, and I'd be in agreement with that. That's kind of how it seemed like our format was before the pandemic, is that we really just had general discussions about things. I think the only thing that we ever really voted on was the budget recommendation. And that was pretty much it. And I think it was just kind of an easier format.
Dr. Susie, you bring up an important point of discussion, because, and Dr. Buchanan or Mr. Sanders help us out on this. One of the 4 jobs of the board as configured by the TCA rule from 1985 was that we set forth a budget. So do we advise on the budget? Does the Knox County Health Department set the budget? How's the budget set?
So I'm looking at the ordinance, paragraph 4 reflects that one of the duties of the Advisory County Board of Health, advise the Knox County Health Department on its annual budget to be submitted to the county legislative body for consideration and adoption. So the mayor will be making his budget presentation May 4th. And after that, we'll bring our budget to you for your review and any advice that you might have before it goes to the legislative session. We may do things differently next year. We may do something before we even send it to the mayor's office. Since you don't have to vote on it, because before we always send it to the mayor's office, because sometimes it gets changed significantly. And when the board still had to vote on it, we'd have to call another meeting to vote on it again. We can talk about how we want to do that, but you just have to advise on the budget. You do not have to approve the budget any longer. So Dr. Hurt's back with us. Did you hear Mr. Sanders answer your questions?
I think I got most of it, which is basically because we're official, we got a sunshine, which is fine. I'm just seeking clarity. Okay. Sorry, yeah, IT is great until it's not. Don't know what happened.
So continuing on, can you share screen share again, please? Continuing on with the rules and stuff. Page 6, section O is how we have allowed for public forum. And so, I'm sorry. Okay. So I guess my question to the board is, do we want to continue having public forum? It's not.
So I'll just start. I reached out to a colleague that's on the newly formed advisory committee, the Health and Economic Wellness, whatever the title is. Just asking, asking if they have public forum, and they replied that no, they do not. And so I, as an advisory board, and we're chosen because we're experts in our field, I don't know that I personally feel that it's necessary.
I concur.
And I forgot to look. I think Shelby County has an advisory board of health, and I do not know if they have public forum in their meetings. I've just now thought of that. I didn't look to see.
Dr. Buchanan, let me ask you about that. As part of the advisory committee, does the input from the public forum in this fashion help you?
Really, the advisory is convened for your expertise. The advisory committee is convened for your expertise to advise me on decision makings. The public can email me. The public can send emails to the health department, general email. They can call. Lots of ways the public can also provide their input. and do provide their input. So I don't feel strongly either way. I really rely on this board to decide what they want to do. So I've heard two opinions.
In terms of a action on whether or not to have a public forum, is this something we need to vote on, or as advisory board, do we have a roundtable discussion about this? How do we proceed if the question is whether or not to keep the public forum or not?
I think what you can roundtable for now, Dr. Gotcher, but at some point you will need to vote on the new rules. And at that point, you will vote on the totality of the rules. Now, of course, you can also vote on amendments to them or whatever you'd like.
Got it.
But at some point, somebody will move these rules into consideration and those proposed rules, and you will vote on them.
So for those who would like a debate on the public forum or a vote on the public forum, I guess the advice would be when it comes time to convene a vote on all of the rules together, somebody needs to pull an amended version out that would either, the amended version would be to pull the section O from the rules. So it's kind of a look ahead. If we want to discuss that, I think that's how it would be done.
Or conversely, Dr. Gotcher, we could just, like we did decide to strike the section on voting, we could decide to keep or strike the section on public forum right now.
That's possible. What's the thoughts of the advisory board on that?
So, Dr. Gotcher, my feeling is kind of goes along with voting is that I don't want us to behave in a way that implies that we have some binding authority that we do not. I mean, we are an advisory group, and so that's why voting inherently implies that there is something binding about the results of that vote, and we know we're advisory. I think the public forum, in a similar manner, if the precedent is that groups that are in an advisory nature do not have a public forum, then I don't want to behave like groups that have that type of authority. I would say we don't have a public forum, not because I don't want to hear from the public, just because I want us to behave as was intended by this change. And I think that, we don't have authority. And so we should act as an advisory body. And so I guess I'm not used to seeing advisory bodies have public forum. And so it would make more sense to me to not have it, but for that reason.
Got it. Appreciate that.
I agree.
So
additionally, we could, if it's not still active, we could activate the, advisory board of health email, if we needed to. So, but really y'all are advising me. And then, again, the public has access to let me know what they think in various ways.
So another way to state this, do we have a consensus not to continue the public forum? Is there any dissension about continuing the public forum among board members? If not, Dr. Buchanan, we could advise striking section O. That would take care of that.
Sorry, I'm muted. Okay. If you will screen share again, please. Actually, it's really, I think the only thing left is on page 7. Again, just the change to clarify that when we're meeting in person, we'll meet at 5:30. When we're meeting virtually, we'll meet at 5 p.m. So, Mr. Sanders, I had no other recommendations for the, I guess, wait, now that we said we're not going to vote, we don't need to have a roll call vote, section B on page 8. So I guess my question, Mr. Sanders, would be, would your recommendation be that I take these and make the amendments recommended by the board, bring them back at the next board meeting for approval?
That would be the easiest thing. Now, having said that, you may want to keep the provision about roll call votes, because when you do a roll call vote, when you do a vote, you still need to have a roll call. You may only vote to open the meeting and approve the agenda and adjourn, but you need to, but whatever votes you have, so long as you're virtual, need to be roll call.
Well, on boards that I serve on, we don't vote on the agenda or to adjourn. We adjourn when there's no more business.
Whatever you vote on. All I'm saying is just keep in mind that as long as you're virtual, any votes you do take need to be roll call. But I understand you're not planning to, you may not have any substantive votes, and that's fine.
Mr. Sanders, as far as, and if this was already said and I missed it, I apologize, but as far as quorum, does that concept exist?
Yes. Well, it exists under Robert's rules, and the default is Robert's rules for anything that you all don't have. I think your all's rules address a quorum, but a quorum is a majority of the members. So count up the membership, and if it's an even number, add one.
Okay. So I guess, again, to the same concept, if I was getting counsel and I was expecting 5 people and 4 people showed up, I'm not going to not hear them out.
No.
You know, so, I mean, does it imply that we can't have a meeting if we don't have a certain number of people?
No.
Okay.
It doesn't. But
if
you were to resolve to make a recommendation, say, which is within your powers, you could resolve to recommend something. That would require a quorum in order to have that resolution voted on. But if only 3 people showed up at the announced meeting time, you don't have a quorum, but you can still meet. It's publicly noticed.
Okay, understood. Thank you.
So I will go through these and make those amendments and bring them back at our next meeting. And for now, I'm assuming we'll continue to meet monthly as we have previously decided, unless somebody else thinks otherwise.
Any other discussions from members on the rules at this point? Information that we can convey to Dr. Buchanan? Since everybody is reasonably pleased with those, Dr. Buchanan, so I think you'll be okay to proceed.
Okay.
Any other rules to talk about? Any other officer stuff to talk about? If not, we'll go on to item 11 on our agenda, which is the face covering regulation 2021-1.
So I'm happy to screen share the face covering regulation. It is the same as the board has had in place for quite some time. It does not have a sunset date, and it is, and so I guess I'm not sure where the board stands on whether we continue to have the face mask regulation in place until such a time as perhaps legislation at the state level changes our ability to have that regulation in place, which I think might happen. So any thoughts on rescinding or keeping the face mask regulation as is?
Dr. Buchanan, this is a question and a comment combined, but I actually had somebody, Nashville, you said you had your comprehensive list of who's got what regulation, and Nashville came out with a graphic where they talked about, it was a kind of infographic. It was a picture that showed, if indoors, this was in the last couple of weeks, and I don't know if it's been changed, but indoors, if you were wearing a mask, keep wearing one. Outdoors, just keep your distance. And so I got questions about, well, when can we stop wearing masks outdoors? And actually, we never, this is for indoor.
Yes.
And so I think that there, at some level, maybe some people who have interpreted this in broader ways. than what was necessarily intended. Now, you know, that there's still other issues here about what, you know, whether it stays and goes in its entirety. But I didn't want to make the point that when Nashville released that, it made me realize that some people don't understand what we have in place here.
Yeah, to tag on to that, this is Maria, to tag on to that, I know we've gotten feedback from concerned citizens about having to wear masks in restaurants and not enjoy meals. That's the mask mandate is clearly, you know, allows people to eat without a mask on. I mean, that's, I agree. There's still some work to be done on clarifying what's in place and what's allowed.
And I haven't had the opportunity to read it yet, but there is some data from Sullivan County where they let their mask mandate sunset, and they have seen an increase in their cases. They're actually also seeing quite a surge of variants in Sullivan County at this time. So their hospitalizations have also gone up. So, I mean, unless the board says we need to sunset this now, I would keep it in place as is. Again, I think that the possibility that we won't be able to have that in place as it is any longer might happen with some voting that's going to occur this week or next, or even with a decision made by the governor at the state level. So. And again, as I stated previously, there are lots of professional organizations that we all trust and rely on that continue to recommend mask wearing indoors.
So as far as recent literature on this, and I've kind of been following this and be happy to share what I have with the group, is that there was an article that came out in a journal called Medical Hypotheses, which was widely distributed nationally, actually, going over various reasons why masks are not useful and why that we need to, you know, quit wearing them, basically. And some of it had to do with particle size, things that we heard about in public forum today. Some of it had to do with excessive accumulation of carbon dioxide underneath the mask and several things. But the two things about it, the journal is Medical Hypotheses, and it was a series of hypotheses about the utility of mask wearing. And if you look at levels of evidence, it was probably about level 5 because it was an expert opinion or series of expert opinions. And there were a series of editorials or an editorial that was in Lancet, I believe, that refuted that later that week. So people have opinions one way or another. They tend to cling to one piece of scientific literature. And I always advise everybody that is introducing themselves to scientific literature to look at the degree of accuracy, I guess I would say, of how accurate this would be, looking at levels of evidence. And the other thing would be to look at the impact figure, the impact number of the journal. Reputable journals like New England Journal, Lancet, Nature, for example, will carry a much higher impact factor than Medical Hypotheses, for example. So those are out there, and people use them to sort of further their own agenda sometimes. And so but always remind our public that there's two sides to those coins often. This science is still unfolding. And remember that about at least maybe a little over a year ago, or maybe a year and a quarter ago, we didn't really know much about this disease at all. We're learning a fascinating amount quickly, but you know, the story is still unfolding.
So any thoughts? Anybody recommending that we rescind the mask mandate?
Dr. Buchanan, just a question. I just want to clarify something you said. So depending on what the governor does, is it with the state of emergency or?
It's either, yeah, it's a state of emergency or the specific piece of the state of emergency that according to the law department allows the local health department to have separate regulations and rules in place from what the state has in place. So he may change his executive order, he may rescind his executive order. I'm not sure what he will do, but I'm hearing that he might do one of those two things, which would change the authority of the health officer and health director, and therefore the health department back to the pre-declaration of emergency and all those orders that went into place, which is a more targeted authority that allows for closing of restaurants and isolation and quarantine of people related to specific cases. But, in the pandemic, we've had, mask mandate for the entire community, regulations over the entire restaurant industry, not specific places that we know might have a problem. So it's a little bit different approach.
Okay. Understood. So back to the original or the broad question, and it's even broader than just mask, but just two things to think about. One is that if you think about this timeline, is that vaccination in our area opened up widely on April the 5th, I believe. And so there were people who really had no opportunity to be vaccinated before April the 5th. And even though the appointments were really tight that first week, after the first week, there have been appointments that people could get to. And so to those people, though, if they got vaccinated pretty quickly, would not be considered to be fully vaccinated until around May the 17th. And so I don't know if that goes into the calculus at all of any of this, but, there is, we haven't had full vaccine availability for very long. And, but we also know that for those who are motivated, who are now eligible, they can get appointments, but it takes 5 weeks from when you start to be considered that if you get a 2-dose vaccine, to be considered fully vaccinated. I think the other broad thing, and this gets back to the hospital piece a little bit, we have seen that as a state, hospitalizations, I think the low point in this recent surge was about a month ago across the state, about 650 hospitalizations. And that has risen to around the 900 range, but it's more focal. It's the Tri-Cities and it's Nashville that we've seen go up, where a lot of the other areas are stable. And so there may be some of that ping-ponging go on, where one area goes up, another area goes down, or the whole state may rise. But the bigger issue that we talked about several months ago was really the healthcare infrastructure. And based on where we are right now, I don't really feel like that it's, the healthcare infrastructure is not at the risk that it was. And I don't know if people realize the extent that it was at risk, but there was definitely risk there. But what you do see, and what we still see in the hospital are kind of these personal tragedies, COVID, as I said, the age is younger, it can still affect, still have profound effects, even on the healthy. And so I don't know how, how does the vaccination opportunity, and because at some point in time, people will have had every opportunity to be vaccinated, and that that's a personal choice, obviously. But how that factors into the overall societal picture, I'm not sure, but I think that's how we're in a different place to some extent now than we were. But it does matter to me that we haven't had full eligibility for very long for vaccine.
Yeah, that makes sense. I think we need to give folks time to get vaccinated. And we're hopeful that the vaccine will be approved for children, which would also be a positive. So.
Well, and actually I stand corrected. I say full vaccine eligibility. That's for 16 and older. That says nothing about those under the age of 16.
So just trying to read the room and not doing a very good job. So, you know, if anybody has a strong opinion that we should rescind the mask mandate, I need to hear that. Otherwise, I'm assuming, as previously, everyone's in favor of the mask mandate. So.
I would kind of stick with how we've always said that's the last thing that's going to go.
Okay.
Unless it's taken away from us, and then it'll all go away.
Yeah, and I agree with that.
Okay. And we'll move on to regulation. Oh, Dr. Gotcher, if you're okay, we'll move on to regulation.
Sure. The item 12 on the agenda is restaurant bar event occupancy limitation closure regulations 2021-2. And Dr. Buchanan, this would have been a regulation that you had brought forth after the change in the board. So that's why the numbers, by the way, are 2021 1 and 2.
Right, correct. So this regulation this regulation does a couple things. One, limits capacity to 50% in restaurants, bars, venues, other similar places, and closes them at 1 p.m. for on-premise consumption. 1 a.m. for on-site consumption of food and beverage. It will sunset tomorrow, I think, unless it's extended. You know, when I talk to my staff, and the few times that I'm out and about, there's not a lot of compliance going on with this one. And so, and we talked, you know, before about the utility of this regulation. And so I don't have strong feelings either way. I think there is some evidence for continuing it. But a lot of the stuff I've read, the evidence, when I look back, those studies are older, when we had higher case rates and there were more people. We didn't have vaccine. We didn't have some natural immunity. So, you know, and thinking about the businesses and thinking about the community, is this one we want to let sunset and hope that we continue going in the same direction we're going.
So, Dr. Buchanan, I don't know that the case numbers and such allow us to completely follow Nashville's lead on this, but what's Nashville doing in this regard?
Nashville, hold on a second. I will pull my handy dandy chart out. So Nashville still has restaurants, bars, venues, retailers must limit occupancy so that 6 feet of social distancing can be maintained. They are allowing retailers to be at 75% or less of occupancy. That's not bars. Bars in Nashville are staying open later. They're staying up until 3 a.m. That's something new. And they also have a difference between places that serve alcohol and places that don't serve alcohol. But places that large venues can have up to 225 people inside, but they still have to be able to space out by 6 feet. So that's kind of a difference between us and Nashville. We don't have a lot of big, giant, you know, I don't know what event venues and other places like they do. So they still have some limitations, and they have some limitations on how much, you know, occupancy they can have. But it's based on keeping 6 feet of distance. I mean, if we did let this sunset, what I would say is we recommend that people follow the Tennessee pledge, which does have that same guidance for 6 feet of social distancing between parties. Nashville does still have a limit on the size of the party that can be seated. I think their limitation is, well, I can't find it. So they do have some limitations. Limit your crowd size inside to 15 and crowd size outside to 25. That's for gatherings. It's not restaurants.
So in our advisory role, board members, what's everybody's thought on this? Sunset it, continue it, alter it? What are your thoughts?
Let it sunset.
What do you think?
So is there, you know, we had a significant discussion at our last meeting about larger events. and they were pulled in at the 50% capacity. Isn't that right?
Yes.
Yeah, and so I guess we don't have that many of those locations, but I guess that one thing that we heard is that there needed to be clarity about, just tell me what I can do. And so knowing, that 50% capacity was a surrogate for, an inexact surrogate for the 6 feet of distance. That's the best we could do. And so I do have, I'm in favor of, I don't think, for example, the curfew is, that part of this is really doing much. And so I think in a general sense, I favor the idea of sunsetting it. I do worry a little bit though about that if it's just, try to maintain 6 feet, that, that there'll be some situations. And I guess in my head, I feel like that a large event is more likely to be susceptible to this than a restaurant who can just, a restaurant can, every other table, every other booth, things like that are, able to manage. But we talked about the mingling and all that of a really big event. It's going to be hard to parse that out though. So if this is an all or none idea, then I would understand allowing it to sunset. I guess, Dr. Buchanan, what I'm asking is, do you have any particular concern about events outside of, restaurants?
And I've got Catherine trying to look through the Tennessee pledge, because I honestly meant to look at it today before we got on this call, but did not get there. I think, I think it's maintaining the 6 feet of social distancing is important. And I hate to sound defeatist, but I think a lot of stuff is happening anyway, regardless of what mandates we have in place. People are, I've picked up to-go food and observed, lack of social distancing in lots of different venues. And there are venues who are doing a great job and they're social distancing and they're keeping their tables apart. And I want to encourage them to continue that, because the last thing we want to do is have a surge. We could just go with the, you have to limit your occupancy so that 6 feet of social distancing can be maintained. That's what Memphis and that's what Shelby and Davidson both have in place. Okay. And Catherine's going to show the Tennessee pledge for events. So it really isn't talking about 6 feet of social distancing at all, is it, for event venues? I'm not sure what the top parts. Okay. It doesn't.
Yeah, the bullets before that.
So is this, I'm not sure what section you're in. This is always hard for me to. Okay. It does say 6 feet of social distancing further up. Not that far.
Dr. Buchanan,
Yes.
the only additional guidance I would provide is that the idea of reverting back to the Tennessee pledge, this document's been with us for months. There have been multiple discussions about just reverting to the Tennessee pledge. I don't know how, look, we all have a sense of kind of where we are and things. I don't know how impactful this will be or how much it will be referred to. And what I mean by that is if you were coming out with something that said something very similar to what this said, I still think it has the potential to be more impactful than just sending the message that, well, just read the Tennessee pledge. And so I mean, we all, I think my sense is we all agree that the 6 feet is important, but how that message is sent to the community could have some impact on how much it's heated. And I think it's clear when it comes locally for whatever duration of time that you're able to, you have the ability to do that based on those other things going on at the state.
Other discussions?
I guess I would just support kind of what's already been said, is that I would be okay with the sunsetting and maybe actually have, as Dr. Shamir recommended, having something that comes out as, specific recommendation that's pulled out. The Tennessee Pledge is a pretty wordy document. And as we all routinely scratch our head to try and remember what's in it, to maybe pull something out as a recommendation regarding that 6 feet spacing in any sort of public venue or space.
Okay, so as opposed to a regulation or mandate, just a recommendation, some guidelines? Or
I don't know. I mean, I guess if we're gonna let it sunset, I would be okay trying a recommendation. Like you, Dr. Buchanan, I've driven around town and certainly seen that most restaurants are not thinly packed.
Well, but I do think that the message you send is it is the public health message to the community. And so I would actually, because then people have that choice. So if Dr. Buchanan says that she feels like that you should go somewhere that it's not about percent occupancy, it's not about what time it closes, but you should go somewhere where your party can be 6 feet away from another party. That's where she feels like we are. Then there are going to be some that follow, some that don't. But it's not just a recommendation potentially. It's got a little more, it's firmer than that. And then there will be people who say, well, I'm going to go to this restaurant because I feel comfortable. I feel like I've got my 6 feet. Maybe I didn't choose to get vaccinated, but I feel comfortable that I have my 6 feet. Where this one's really kind of crowded, and that's just not where I want to go. And so, Dr. Souza, I don't know for her whether, we're at this point where if it's a recommendation, is it regulation, is that going to matter? I'm not really sure. But I think it's important still that stance from a public health perspective is that they know where you stand on it.
okay.
Other discussion? Dr. Buchanan, do you have the sense of the group here about where to proceed on that? You need more input?
No, I mean, it sounds like, I need a recommendation versus regulation, but some strong language about distancing in restaurants and bars and other venues to reduce risk needs to continue to be in place. So I can take that and talk with my team here and come out with something that hopefully makes sense and is usable for our business owners here. Because these policies hard to write to make it clear and understandable. Because you have in your head what you're thinking, but you put it down on paper and somebody else reads it, doesn't always translate the same way. So try to make it as specific as I can and as easy to understand as we can. And I agree, the Tennessee Pledge is a little challenging to navigate. So we could put something in place locally that would provide guidance. I will say there are a lot of things at play in the state legislature that could impact the health department, could impact, not really this board. This board's already been impacted. None of the legislation is about advisory boards, but it's about the health department and the health officer and who can quarantine and who can't quarantine. my understanding is the legislature probably will wrap up meeting by the end of this month. So they will either get voted on and be in place or not be in place, or I guess they die. So we're kind of watching those. We'll see what happens. We'll keep you posted. And I thought there was something else I needed to ask you all about this evening, but I don't remember what it was. I would like to keep our meeting the way it is on this particular Wednesday, at least for now. When things change or calm down, we could probably go back to our quarterly meetings, but right now I feel like we still need to meet monthly. And appreciate everybody's willingness to do that. I have requested that the Academy of Medicine submit a nomination for Dr. O'Brien's seat. That was an Academy of Medicine seat. I have not heard back from them. The process for that would be that nomination comes to me and I submit it to commission for their approval. And then it would get voted on at the commission meeting that follows. So that is in process. So just, I think probably waiting for their board to meet to have a nomination process internally.
To Dr. Buchanan, to the board, is there any other business? We're at that item 13 for other business. Anything else to discuss this evening?
I don't have anything to discuss, but I guess I just wanted to express my gratitude for my fellow board members as well as Dr. Buchanan sticking around. Public health officials across the country have been fleeing the ship like that's sinking. And I think that a lot of credit goes to her. She's had a really tough year, I'm sure, as have a lot of people. And I just appreciate her sticking it out with us.
Thank you.
Agreed.
I think we all stand in appreciation, Dr. Buchanan. It's been a tough year, and things have changed so much, both from a health standpoint and political standpoint. But I think we all stand ready to help. Just let us know what we need to do.
Sure. And I'm very, as I said at the beginning, appreciative of you all staying the course and continuing to advise. And I'm really appreciative of my team who have stayed the course and continue to do what the next right thing to continue to protect the public's health. So I'm proud of the work that we've done as a board and as a team.
There's no other business. We need to probably, as a final thing, get a firm date for our next meeting.
Dr. Gotcher, can I raise just one kind of point of brief conversation?
Sure.
So, I mean, if we have an issue facing us now, it's going to be vaccine hesitancy, I think. And so and I wish I had the answer to advise Dr. Buchanan about related to that. But, new creative strategies are going to need to be found to try to reach those people who are kind of, that they are considering it, but they're not sure. And I hope that motivating factor is not that cases go back up. We don't want that to be the motivating factor, but there's enough going on with the variants, and there are some variants that aren't even here in the United States yet, or that are barely here. And those are actually more concerning. And so, there is a vaccination is a long-term play on this. And I think that's something we'll need to continue to talk about. But if I had to say, what's the one thing to focus on, and I would, have it as we have a discussion about it on our vaccine meetings. We have a discussion about it internally. We're doing everything we can do, but how to reach those people who haven't been reached, I'm not sure that we have those answers quite yet. But that's something we all need to be thinking about in our ability to advise Dr. Buchanan, because that's, we've done well in Tennessee, but I could not believe the rate that it slowed down, how abruptly it slowed down in terms of interest. That's it. Dr. Gotcher, I wish there was action that I could put behind that, but I at least wanted you guys to hear that's truly an area that we need to be thinking about.
So, Dr. Shamia, just a question along those lines. What is the penetration of vaccination in, what is described as the most vulnerable groups, or nursing homes, or folks over 65? Has that vaccination penetration been effective?
Dr. Buchanan may have those at her fingertips, more her team. I think it has been reasonably effective in those groups.
It has been, yeah, so you're looking at vaccinations in Knox for people who live in Knox County. And this, so again, I'm sorry.
Top table.
Yeah, the top table. So are over 65, 66% are fully vaccinated. And we looked at our African American community as well, and for the number of people, I used to have that number. It looks better than 4%.
Yeah.
Because that's 4% of people vaccinated, 4% of that population. It's higher than 4% in that population. Does that make sense?
Mm-hmm.
Thanks to some efforts of some really great community groups, as well as our team here, to penetrate those other groups, as well as our Latino population. So we have some really concerted efforts. But the efforts to get folks in nursing homes vaccinated were very successful. And I mean, if we look at flu vaccine uptake in that population, it's always much higher than everybody else. They get their flu shots. Little kids and old people get their flu shots. I haven't shared this data with this group, but I can send the study. It's a small study that the state did, and with a group that's helping them crafting some of the messages around vaccination to increase vaccination. And the conservative population is very vaccine hesitant. So that's one of our challenging groups that we want to try to increase vaccination rates among those folks to provide protection. But it's a large group for us in East Tennessee, and a group that if anybody has connections with those groups, certainly feel free to take the vaccination message to them. You know, what we're hearing is from people is they want to hear from people like them. They also want to hear about the data, and the data is really good with these vaccines. They want to hear it from, that's where I hope some of our doctors in the community can help with that as they're seeing patients and talking to them about vaccination, and answering their questions from a trusted source that they've known for a while. I think in one of the things we heard this week was we've kind of reached a point where there are a couple of groups that need to be vaccinated. The folks who are just unsure and need a one-on-one conversation with somebody they trust with the data and information to make that decision. Do I get vaccinated or do I not get vaccinated? And then the other group is probably people who work and aren't able to take off very easily to get vaccinated. So that's why we're having some Saturday events, and others are having Saturday events. We're talking about, we're probably going to create some strike teams that can go to places. Obviously, there's a limit to that, on how many places we can go to. And trying to connect employers with groups that can come out and vaccinate their employees on site, which makes it easier for them. That's where we're really hopeful with Johnson & Johnson that we'd have some that available. Obviously, going out to an employer, vaccinating their staff that want to get vaccinated one time is a whole lot easier than going out twice for the employer and for the vaccinator as well. Unfortunately, it's on hold, but and we're being very trying to be intentional about reaching out to groups that we think need vaccination. So.
Any other business to come before us this evening? If not, I think we've had an interesting, productive meeting as an advisory committee. And do we have a date, or Dr. Buchanan, will you send us out a date that works? I don't have a calendar in front of me.
Right, Anderson, do you have that date?
Yes, if we stick with the third Wednesday of every month, it's May 19th,
May 19th.
I do believe.
And that will probably very likely be in person, but we'll know more later this month.
Okay.
Yeah, if we're going to stick with the third Wednesday, the public building authorities got several reservations being held based on the biweekly schedule and all of that. And I need to kind of firm up with her which ones we can let go of. So that's a discussion that I don't know how you want to have that, but if we want to just try to stick with the third Wednesday, I have placeholders for some of those that changed. So
yeah, we'll continue with the third Wednesday for now.
Okay.
Maybe through the summer.
Okay, that sounds good. I will get back with her then. Thank you.
Okay.
If there's no other business to come before us, we can adjourn, and appreciate everybody's input this evening, and look forward to hearing from everybody in the interim and also on May the 19th.
All right.